the public has the opportunity to address the commission on any matter not appearing on this agenda. However, no action may be taken on a matter raised until the matter itself has been specifically included on the agenda as an item upon which action may be taken. And I'll refer to Ms. Maddox, our Assistant DA. You have a comment?
Thank you, Chairman. For purpose of this agenda item, I want to make everyone aware, the public on this call, that the board welcomes your comments. Your comments are very important to them. All comments, as the chairman indicated, are limited to 3 minutes. It is very helpful for the board if you would give them your name prior to making your comment. Please address your remarks to the chairman of the board. I want to note that the board will not be entering into dialogue at this time. It's not meant to be a question and answer session. The purpose of this agenda item labeled public comments is for you, the public, to inform this board about your views. If members of the public do have questions, I want to let you know that we are working on a different forum so that we can get those questions to the county health officer and he can answer them. So thank you. Mr. Chairman, I'll hand it back over to you.
Okay, thank you, Wendy. I will turn this over to Dave Mendiola, our county manager now.
Mr. Tipton, prior to doing that, I would ask you to ask the public if they'd like to make any comment at this point.
Yeah, I'm just going to make a comment on that, Wendy.
Thank you.
You can unmute if you're in, I'm not sure whether or not you'll be able to unmute your own phone, but let's go ahead and give it a try. I think we had somebody just tried to get in, and so go ahead.
Hi, hey, this Mike. Can you hear me?
I hear you good now.
Oh, okay. Yeah, I've been listening. I just couldn't. Nobody could hear me, I guess. So it finally went through.
Good. Glad to have you. So, folks on the line, again, if you would just unmute your phone and again announce yourself for the record, and then we'll take your comment.
Hey, Dave, this is Alicia Heiser. I just wanted to let everybody know that City Council and the Mayor is with me here as well. We're getting ready for our budget workshop, and so we're calling in at least for a little while, and we've got everybody here.
Great, thank you, Alicia.
Hello, this is, for the record, this is Valerie Quape. I am the Rural Regional Behavioral Health Coordinator, and I just wanted to make a quick public comment. I am also a board member of the Nevada Public Health Institute, and the board's and that institute's purpose, or one of their purposes, is to support the formation of local boards of health. That was also my area of research as a graduate student. I've reached out to Julia Peak to offer my assistance, but if there's anything I can do for this board as well, I'm happy to do so. Also, as the Rural Regional Behavioral Health Coordinator, I wanted to give this board a heads up that because of concern of the virus, as well as potential economic impacts, there is likely to be a surge in needs for behavioral health services in the upcoming future. So any public health plans that come forward after this direct emergency, we really kind of need to take that into consideration. Also, as a part of my scope of work this next grant cycle, to work with local public health preparedness or emergency preparedness officials to ensure that we are also planning for behavioral health needs. So I will be connecting with them, but I wanted to introduce myself and make myself available for you.
Thank you, Valerie. Anybody else have a comment?
Can you hear me?
Go ahead.
Hi, this is Shelby Sowers. I just wanted to let you guys know that I'm listening in.
Great, Shelby, thank you. Any other public comment?
Hey, Dave, it's Tim. I'm gonna interrupt you for a second. It's if anyone's calling in by phone, it would be *6 to mute and unmute your phone. It's just a toggle.
Great, thanks, Tim. So *6 to unmute, and then to mute again, *6. Do we have any other public comment?
Hi, this is Patricia Tyndall calling from the Pleasant Senior Center, and I'm just calling in to get information. I do have one comment, and it's for Dr. Stringham, and that is we are getting information about people who are testing and people that are testing positive. but no information about where they are, if they're out in the community or not. And my clients are very concerned. They also gossip a lot. And if we could have a little like actual information about, it doesn't have to be HIPAA related, but just the person is recovering or something like that, it would make my clients who are at risk a lot happier to have real information instead of looking at Facebook. So that's my only comment. Thank you very much.
Thank you, Patricia. We will actually address that later on in the meeting under when we discuss disseminating critical information to the public. So if you stick on the line, I think we may be able to answer that question. Any other public comment? Hearing none, I'll turn it back to Commissioner Tipton.
Okay, so the next item that we have here is update on public health officer and local emergency manager on county plans specific to the COVID-19 coronavirus. Consideration, discussion, and possible action regarding current efforts being made to reduce the spread of COVID-19, as well as direction from Humboldt, from the county health officer, Dr. Chet Stringham, regarding specific protocols for citizens and businesses to follow. Discussion and possible action. I'll return that back over to you, Dave.
Dave Mendiola for the record. Folks, just to give a little historical background here, obviously the COVID outbreak that really became known to most of us was in late February, early March, and became more of a local concern about mid-March. The one thing that we did not have in place in the county was a county health board, even though it was required by NRS statute, and it just had really never been necessary as best I can tell. So we very quickly put together a meeting on March 23rd. The Humboldt County Commission appointed Dr. Chet Stringham to become the Humboldt County Health Officer. And then today is the first meeting of the Humboldt County Board of Health. And just so you know some background on that, the board by statute is made up of the county commissioners, which is Ken Tipton, our chairman, Marlene Brissenden, Jim French, Ron Sherry, and Mike Bell. In addition to that, Sheriff Mike Allen is appointed to that board. And then also Dr. Stringham is the chairman of the County Health Board. So we'd have Dr. Stringham running this, but he's got a lot of information to provide. So we're going to allow him to kind of bring us up to speed and give us an update to start. And I think that's where I want to go right now, is to Dr. Stringham. And first of all, I want to thank Dr. Stringham on behalf of Humboldt County. I am been so impressed with his dedication and his desire to bring this thing to a halt in Humboldt County. And he's all in. We have spent hours on the phone together, along with many others in the community, and I just thank him so much. So, Dr. Stringham, I'm going to turn it over to you and allow you your comments.
Excellent. Dave, thank you very much. Can everybody hear me all right? Is there any feedback on the microphone or any sound quality issues?
Sound good.
Excellent. Okay. I'll go ahead and start my comments. Good morning, everybody. So first thing I'd like to do is challenge the people of Humboldt County to do something that I think is truly grand. And that is, if every single person in our community does the right things, we could experience the very last case of new case of COVID-19 in our community within about 2 weeks or less. This is technically a very easy thing to do, but it just requires a number of things that people don't tend to do, and it requires a number of philosophical changes. And my plan really outlines ways that we can go about doing things like that. So the first thing I want to be able to say is, let's just start with the basic stuff. Social distancing is extraordinarily effective in ending this virus, period. It is the single most important thing any of us can do. And 6 feet is a guideline. I personally like a little bit more, but I think it's very critical to stay away from all other people at this time. The second is that if the viral particles themselves are never introduced into somebody's eyes, nose, or mouth, then it is not possible to get this virus, period. And we need to concentrate on that. I'd like to also say that the virus is not the threat. The threat is what we're doing. And I'd like to emphasize, in fact, the entire program really that I've come up with and that our team has come up with emphasizes what people can do and de-emphasizes this virus. The virus is not the critical issue. Our behaviors are the critical issue. And this entire plan aims to change people's behaviors. That's basically the nuts and bolts of the program. So most programs like this are really about public education. And I would like the board really to take the approach of public motivation, because I think that's really what we need to be doing in this case. It's a matter of motivating the public to do the things that we're going to talk about, the things that are important. So our biggest single threat is our approach to this problem. And it's my belief that the approach that many in our community are taking now is not the right approach. We need to change that approach to an approach that is more like the one that I'll outline here. So in terms of the early stages of the fight, we're really trying to combat preconceived notions, because a lot of community members are fighting this virus based on what you would think to make sense with this virus. And in the end, they're not really very helpful solutions. So we need to change to more helpful solutions, which we'll be talking about in a little while. So in terms of a police officer who learns to deal with an active shooter situation, it's not just a matter of doing the right things. It's a matter of stopping the things that you would have done before that training. It's very important to change the way that you approach the situation. Dangerous things don't necessarily look dangerous, and in a lot of cases, we're not responding to the right things. So I want to talk briefly about what it is that's dangerous versus what just seems to be dangerous. So the first is that most of us are out there scanning for people who are coughing, who have fevers. We're trying to stay away from specific people, and that is just not an effective strategy. The problem is that many of the people who will infect others don't have symptoms themselves. So if we're out there looking for people who have fevers and other overt symptoms, then it's very likely we're missing people who will actually infect us. This is a classic case of not being afraid of the right things. Several mornings ago, I was driving to my office. There were 3 people on a bench seat in a pickup truck riding together. It was a work truck. And I thought to myself, why are they not afraid of this? That scares me. A person standing 8 or 10 feet away from me doesn't scare me if they're coughing. That's not a true threat. So we need to focus on what threats are and defocus on things that threats are not. I personally think that Humboldt County is in a very unique position, and I'm going to talk about that later. We're relatively remote. We have a relatively small number of people per square mile, and we're relatively isolated. We also have very well delineated borders, as opposed to New York City, which is close to various other metropolises, and it just blends into one. Many different governments, many different officiating agencies, very difficult logistically to treat this problem. Our community, on the other hand, has a golden opportunity because of where we are, and who our people are to eradicate this problem in our community. And that's really what my invitation is. I'm going to talk about exactly how to do that. What if we don't? Well, extracting some data that we have from having approximately 1% of the people who suffer from this illness pass away. And if we extrapolate forward, if we let this virus go in our community and it went to completion, we could expect to lose almost 200 people in our county. The bottom line is we're not going to let that happen. I want to tell you a story because I think it illustrates what we need to do here. And that is, when I was a little boy, my dad and I were driving on a winding mountain road, and the cliffs were really intimidating to me. I was about 7. There were no guardrails. And it suddenly occurred to me that my dad might be the only reason that we weren't going to die that day. And I asked him about that, if it was theoretically possible for the car to go over the cliff. And he said, yeah, it was. And I could be seen, I guess I was very uncomfortable. And my dad said something very simple but profound and very applicable in this situation. What he said was, we're not going to let that happen. We're going to do the right things. And that's what I tell the citizens of Humboldt County, I tell this board, that that's exactly what our approach is going to be. As long as every single person in our community does the right things, that's not going to happen. We're not going to let it. Next, I want to dispel a couple of misconceptions because they're going around the community and they're dangerous. They're not very helpful. So the first is that this is a lot like influenza, the flu. And what I can tell you is it's nothing like influenza. This virus has a lethality, a probability of killing its host of about 1%. That's 10 times higher than the flu. This is not like the flu. It's also about twice as infectious, meaning that about half of the viral particles are required to infect a person. It's very dangerous. This is nothing like the flu. Second misconception is that it's really only dangerous for elderly people. And I'd like to explain that that's not the case at all. Plenty of physicians, young physicians, have died in Italy, and plenty will likely die in the United States. And many other people, nursing staff and young, healthy people are dying of this illness. So we need to rid ourselves of the fact that this is only dangerous for older people and people who have underlying conditions. It's dangerous for all of us. I'd also like to discuss a statistic that I think is particularly dangerous, and that is that based on the misconception that everyone will eventually get this virus, and that's not true. If everybody in the United States got this virus according to that theory, we could expect to lose between 3 and 4 million people across this country. So the misconception that this is ubiquitous and that it'll eventually happen to everybody is highly inaccurate, and it misses the point of what we need to do. So what exactly do we need to do? Next, I'd like to roll out the plan that we've come up with. A number of us have worked on this very diligently. The plan takes into consideration a lot of different things. But first, I want to talk a little bit about the basics of the plan. This is not necessarily only a plan that tells people what to do. This is a plan that teaches people how to think and what to see, what to notice, what issues are dangerous and what issues are not. It relies primarily on self-reliance, because I think it's important that our community focuses on what every single one of us can do to stop this virus. Self-reliance. Every one of us takes power for ourselves, and if everybody does that, then collectively the community will come through this unscathed. My feeling is that in the end, we can only control ourselves. And if every single person in our community always, under all circumstances, respects social distances of 6 feet at least, and my preference is 8 to 10 when possible, and we certainly have the real estate here in Winnemucca in Humboldt County to do that. There aren't that many people in our county, and we can do this. This is very important that we do. The next thing is that we're not relying on other people to do what's right, because if every single one of us does what's right as individuals, then collectively all the right things happen. It's very important that we do that. I'd like to draw your attention to a car accident, and that is that none of us have as our primary safety strategy while driving that we hope that other people will do the right things. We hope that our legislators will pass safer laws. We hope that the manufacturers will make better and safer cars. Most of us have as our primary strategy that we're going to do a good job driving. The fact that we're wearing a seatbelt adds safety, but it's not our primary safety strategy. I'd also like to point out that the fact that most of us will never know the driving records of the people operating vehicles next to us, we'll never know what that information is. But we can still make safe plans by doing the right things ourselves. We're running into a lot of trouble with HIPAA laws and various other guidelines, and it's very difficult for people in the public to be able to get information about other people. People are wandering around wondering who might have this virus. but it's not an effective strategy. The effective strategy is to concentrate on what you are doing. If every single person in your environment has COVID-19, but you do the right things, you will not get this virus. It's no different from driving a car. We drive defensively enough that dangerous actions on the part of other drivers around us are not dangerous to us, period. That's the way it's done. So that's the individual level. The community strategy in terms of getting this word out is varied. The primary thing so far is that I am getting a lot of the information that I'm conceiving and the philosophies, the strategies out to the community on a Facebook page that we've created with Nicole Maher's assistance. And the name of that Facebook page is Stop Coronavirus in Humboldt County Now. This page contains a lot of helpful advice about changing the way that you see this. The virus is not the threat. Our behavior is the threat. Social distancing is a fantastic thing, but on this website, we also talk about creating social pressures. Social pressures are ways that we influence others in our surroundings to do the right things. And if we can influence everybody and we can also always do the right things ourselves, then this whole thing stops very quickly. All the mayhem, all of the fear, all of the various negativity goes away very quickly. At the community level, everything so far has been at the individual level. At the community level, a lot of things that we're doing there also. So the first, in the early days, which was a week and a half ago, we were really concerned that that somebody might introduce this virus into the community. There were no cases at that time. And subsequently, we've developed a number of cases. We knew that the virus would come to the community in the form of a visitor, and that is exactly what did happen. So we have a team, and it's in the early stages of design and implementation at this time. And that team is a team of volunteer health educators. We're eventually hoping to get people from the community to assist in this, in making telephone calls and various other things, various other means of communication with the public. And emergency medical services at Humboldt General Hospital will also be very instrumental through our community paramedicine program and through the efforts of people like Jordan Kohler. So a number of different things that we'll be doing in order to approach primary businesses, people in the hospitality industry, people in the gas station industry, convenience stores, other retail, and we have a number of different partners like Jeff Dawson, who's assisting us at Walmart with a lot of the various procedures and policies that they have that are all well developed at this time. So we're going to make those ubiquitous for all of the various businesses so that when this is eradicated in our community, it can't come back in the form of a visitor from another community. Second thing that we looked at was mine transportation. In the beginning, when Dave and I and Sean Wilkin initially spoke about this, my biggest single fear was that we had a lot of people on buses who were going out to mines. We made contact with each one of the mines and did not have to take the role of educator with them. In fact, each of us took the role of listener. We were all very impressed with what the mines were doing. They already had wonderful and concerted plans already in place. It was very impressive. And they taught us quite a bit and even brought up things that we hadn't considered. Third thing is kind of controversial, but I think it's very critical, and that is masks. In the early days of this outbreak, N95s became incredibly hard to find, and they still are. Problem is, the concern that most of us have is that if we give everybody an N95 mask, it takes those masks away from people who are at highest risk of exposure. We didn't want to do that because we thought that would be relocating the risk rather than reducing the total risk. There's a group of people here in Humboldt County who are manufacturing at their own homes, at their own expenses, with their own materials, their own time, masks that are built to very high standards of cotton material, have 4 layers and a bellows type design with a tie in the back. and they're becoming extremely ubiquitous in the community. We're coming up with a way to distribute those a little bit better. We've had several people come to my office and deliver them, and I know that Dave Mendiola has also volunteered to assist in distributing those masks. It's a very important thing. You'll hear a lot on the internet about how effective these are, but just because a seatbelt won't protect you in every crash doesn't mean we don't wear them. And the bottom line is a mask is a good part of a safety strategy. Initially, our philosophy was that we would distribute these voluntarily among the bus riders who are going out to the mines. But in light of some of the most recent data that we're finding, it's going to be my recommendation in the next day or two that all people in Winnemucca who are able to get a mask wear a mask when they're out in public. It's not perfect, and there's a lot of negativity about them on the internet, but the bottom line is it gives an extra level of security because we can't always guarantee that all of us are perfect at staying exactly 6 feet or greater away from other human beings. So it's an important strategy. Staying at home, wearing masks, and maintaining social distances. Those are our primary fighting strategies. I'd also like to explain that if a person accidentally gets viral particles on their hands, that can also be transmitted to the face. This virus needs to get into either the eyes, nose, or mouth in order to be able to infect a person. And so if we never touch our face, we're not able to get this virus. Hand washing is very important, and also washing of surfaces. All of that's covered on the website also and in our public education teams. Daycares and families create a new kind of an interesting dilemma, and that is that a couple of two people, and because those people are going to be coming together in their own homes, it increases by twofold the probability that each of them as a set will become infected. It's like flying a twin-engine airplane. It just increases the probability by twofold that you're going to have an engine out. The bottom line is that both members of that couple need to be extraordinarily careful because if one gets this, the other is very likely to. Which brings me to the next issue, and that is daycare centers. That was the next issue on my list. And that is that when the schools closed, creating great hardships for students and educators and other members of the community, you need to realize that if we have many different families who are all pooling resources to have kids go over to one house from 3 or 4 different houses, that's a way to communicate this virus from one family to another. And it's very important that people not do that. If people are sharing resources for childcare at one house for the families of 4 or 5 different people, then essentially what we're really doing is negating the advantages to having closed the schools. Very important to do that. I also want to cover that yesterday, Governor Sisolak had come up with 2 new orders that I think are going to be very helpful in our fight. Businesses, non-essential businesses, and I personally don't think any business is non-essential, but the way that things have been defined, there are certain businesses that are absolutely critical, and I don't mean to imply that people whose businesses have been closed are not essential, that we're all essential. But the new restrictions, even more restrictive, I think are going to help us even more, and I do support Governor Sisolak in his efforts to keep us safe. So the next thing I'd like to move on to is what happens when people become ill. And I'd like to explain that we have a lot of very dedicated people working at Humboldt General Hospital and various other agencies and institutions around town. All of us are doing a wonderful job, in my opinion. I want to explain a little bit about what our community is doing for people who become ill. And at first, I don't think any person is more important than anybody else, but I would like to mention one person by name. Robert Johnson is working over at the West Campus Clinic, which is our primary receiving area for ill patients, people with fevers, coughs, chest pain, shortness of breath, or other symptoms suggestive of COVID-19. Robert is doing a fantastic job, and Robert is quite literally the very tip of the spear in our community in fighting this virus. We ask that people go to the West Campus Clinic if they have symptoms after calling the West Campus Clinic and getting instructions. So the clinic will instruct you on exactly what to do, and usually tests are done while still in people's vehicles. so that the exposure is minimized. The hospital has done a fantastic job coming up with a very safe plan that keeps the providers and the ancillary supportive staff safe also. There's also a new ELCO hotline, and we're able to use that as well. There are a number of other organizations that are working on this too, medical students at the University of Nevada, Reno Medical Campus. And they're screening people, giving various forms of brief advice and instructions on what to do based on the symptoms that people explain on the telephone. In short, these people are keeping people out of hospitals where other people may be infected, except when necessary. And next, I'd like to talk about testing. I've been approached by a number of different people. This has been one of the most common questions. The testing is changing very quickly. We're seeing a lot of metabolism in this area. There are a couple of different reasons why. I'd like to point out that ideally we'd be able to test every single person who'd been exposed to this virus or suspected they had been. But as is often the case at the leading edge of various types of events like this, we're in the process of ramping up as this is going on in the initial stages. You're never 100% prepared for something like this. I think that the testing has been one of the areas that we've really had some issues with. Initially, our hospital was having a difficult time getting enough tests because those tests were not available. It's my belief at this time that the number of tests that we have is adequate as long as we don't use testing as a primary diagnosis strategy. The primary strategy is staying away from all other people, because if everybody does that, then nobody will need to be tested. That's really the strategy. It's a matter of changing our philosophies. It's very important that we do that. So at this time, testing is limited primarily to people who have symptoms, and not just have symptoms, but have symptoms that are highly suggestive of the virus. The concern is that if we test everybody, we'll quickly run out of tests that are needed for critical patients. We're giving preference to people who are involved on the front lines of the fight. And so we really need to know if medical people are infected, because we have the capacity to transmit this to other people. It's most dangerous. Early cure strategies, meaning that the time that we released people from respiratory isolation, those were generally done by 2 successive tests. But the problem was that we were burning up a lot of tests by doing that. And so now releasing people from respiratory isolation is done based on time, the units of time that have elapsed since the person's last symptoms and also since diagnosis, rather than doing additional testing on people when the tests are in short supply. I do have a little bit more information about tests soon. We'll be in a position to be able to do antibody testing. And those antibodies are going to be a real game changer for us. The problem with testing is that in the early days, the initial nasal swab testing that we're still using was that initially it was taking about 4 to 5 days for those test results to come back. And at this time, some of the tests are coming back quite a bit faster. We're able to receive a test within 24 hours a couple of days ago. Made a big difference in the care of a person who'd come in contact with quite a number of people when we learned that he was negative. So that was kind of a nice thing. But the antibody testing is going to be a real game changer because it's almost instantaneous. We can do it here in the community. Nothing needs to be sent out. And it's available very, very quickly. Also, the number of tests is much less limited than the current tests that we have. So stay tuned for that. I was advised by Karen Cole that the hospital is going to be procuring one of these fairly soon, and I applaud her for her efforts and for the other people who've assisted in getting this device also. Not sure exactly when it's coming. We were told sometime in April. Real game changer, fantastic thing. The next thing is what we do when a test is positive. So this test or this question was asked by a number of different people, and I know that you'd like me to outline this and tell you exactly what this process looks like. When tests are positive in Humboldt County or any of the other 16 counties across our state, those tests go directly to the state epidemiologist's office. And what I can tell you is these people are all over the problem. I've been very impressed by their response. In all cases, when I've called to let them know that there's a new case, they already know of these cases, and they're usually already working these cases. What happens is those people, state epidemiologist's office, comes up with a way using a very advanced computer program and strategies to call people, make contact with various folks. They come up with a list of people who potentially have been exposed to that individual. They question those people on phone and figure out whether or not that constitutes a true contact. And if it does, then the state epidemiologist's office will put those people into quarantine, usually for 14 days. That's actually a longer quarantine period than the people who are known to have the virus in some cases. And the reason is because the longest of cases are taking about 14 days from the time of contact with the person who's infected until we can be sure that they're not infected themselves. The problem comes in where tertiary, what are called tertiary contacts, meaning that a person has contact with a person that has contact with somebody who's known to be positive, that second person in a tier, are they at risk? And that's a very difficult question to answer, and we're always behind the power curve on that question. That's one of the reasons that I would shift your attention back to something that I consider to be more important. If every single person maintains the correct distance away from other people, all other people at all times, then if the state epidemiologist's office ever has to call you, if you explain that I have never been closer than 6 feet from another human being since this started, the state epidemiologist's office will congratulate you and will let you go. That's why we need to focus on social distancing and not any of the other strategies that we've talked about. Social distancing makes everything else unnecessary. The other things are done for extra security. Hospital preparedness. I have attended a number of meetings that the hospital is having every single morning at 8 o'clock in which we discuss the readiness, the strategies, the supplies, the staffing, and various other aspects of this emergency. It's my impression, after having attended many of these meetings, that the hospital is well prepared to deal with the complications in the event that the community loses control of this virus. The hospital is there for us. I'm very impressed by the work that they're doing, and I'm convinced that they're well prepared for this. But I would invite members of the community to do all the right things to make everything that the hospital is doing unnecessary. Very dedicated people there who are more than happy to help people if they become ill. I am hoping very much that they don't have to do anything. I'd love that, if everybody is well. I'd like to discuss one other thing, and that is an ancillary hospital that will be going in on Friday. It's a medical facility that will give us in our community the ability to care for other people in the event that this outbreak were to get out of hand. But I would implore you, we are absolutely in control. It is critical that all of us make the efforts that are being taken to control this virus in the event that it gets out of hand unnecessary. We have the power to do that. I'm going to talk a little bit about my role in this, and I can tell you that I'm very honored to have been tapped by you folks to help in this crisis, and I'm very, very proud of what we're going to be able to do here. I'm only one person, and I think we have some wonderful resources in our community, some very dedicated people, and I would defer to them as the people who are really doing wonderful things here. All of the members of the medical community and all of the members of our general community who are the very ones who are going to stop this. I am a person who thinks of strategies. I'm a person who announces those strategies. I educate people, and I also try to energize people to do the right things. And that's my role in this. I want to offer a couple of closing thoughts. Rather than to summarize what I've talked about, I want to offer you an invitation. I want to invite the people of Humboldt County to do something truly grand, something that we can be very proud of. I want to invite you to do all the right things all the time, and to invite others and engage others to do the right things too, to be kind to others when you see people doing things that are dangerous. Everybody's stressed right now. And when you see people who are doing things that they don't realize are dangerous, please reach out to those people so that everybody can get through this. Nobody in our community needs to die. I want to extend one last invitation, and then I'm going to close. We're not the only ones who are having a hard time. People from all around the world have had their entire lives disrupted by this horrible illness. The people of Humboldt County are in a very unique position because Humboldt County is remote. Humboldt County is well defined, and Humboldt County in general has very motivated people who are able to do something for science that would be very important. If we can eradicate this virus in our county, the data that we can create will be immensely helpful to people in other communities who are suffering as much as we are. If we can do all the right things, the data that we can create will be helpful to epidemiologists for a very long time. And it'll also be helpful to people everywhere. I invite you to do the right things. Thank you.
Thank you, Dr. Stringham. Really appreciate it. Next up, I'd like to turn it over to Sheriff Mike Allen for a few comments. Sheriff, can you unmute your phone, please?
Okay, thank you, County Manager, and good morning, Commissioners and Dr. Stringham. Dr. Stringham, that was a lot of information, good information that you just presented there, and I think we're very fortunate to have you in our community. Humboldt County has been tested over the past several years with flooding, wildfires, and now the coronavirus pandemic. Our emergency management program in Humboldt County is more robust than it ever has been. Some of our training includes training completed at the CDC on the Strategic National Stockpile. And over the past year, Captain Wilkin attended 4 weeks of specialized training in emergency management. We have also been working closely with other federal, state, and local partners to help ensure we have access to additional resources. I'm confident that we will get through this, but we need to remain vigilant on social distancing and adhere to other recommendations of the CDC and what Dr. Stringham said earlier. And once I do appreciate the patience and understanding that the public has demonstrated over the past few weeks. And I want to thank you, everybody, for your cooperation in this. And like Dr. Stringham said, it has disrupted numerous lives all around the world. But I think if we remain vigilant, we can beat this. Thank you.
Thank you, Sheriff. Next up, Captain Wilkin, I'm going to turn it over to you. But before I do that, I'd like Karen Cole from Humboldt General Hospital, the Chief Executive Officer. Karen, could you make just a few comments in terms of the preparation and the things that you're doing at the hospital?
Thank you, Dave. Well, it's just humbling to be here with all of you and to see the group that's come together to lead this county as we move forward. I don't think that there's anything I could say in terms of prevention that hasn't been said so eloquently by Dr. Stringham. And I want to make sure that somehow we get this recording out so that everybody in this county has an opportunity to hear what he had to say today. Dr. Stringham has been great to work with, coordinating the efforts of the county with the hospital. It really is a collaboration between your hospital and all the city, the county, all the officials, and certainly at the state level too. We had a board meeting on Tuesday, at which time I visited with the board and, of course, the public at that same time about the preparations that have occurred at the hospital since January. This is not an event that we've just been addressing in the last few weeks, but I have worked with a wonderful, wonderful team of people to help bring insight bring the information that's happening across the world from all the various agencies and associations, so that we have top of the day information. And I can tell you, not one person can possibly do that, but when you bring a team of people to do that, it helps the team to make the best decisions that they can at the time. I want to point out that we have a medical staff who have been very dedicated to bring that information to us, and the decisions that we're making, the preparation that has occurred since January, is the effort of the medical staff with the hospital administration and other leaders. You already know about the screening clinic that we've put in place. That's just one of them. That's a very visual example of the kind of actions that we've taken. And of course, the most recent action that we're been working on, Dr. Stringham alluded to, and that is working with our EMS and with the city and the county officials in putting together this field hospital. We certainly hope that everyone listens to what Dr. Stringham has to say, so that we never have to use that field hospital. But should we need it, that's where our efforts are in the next couple of days. And again, I want to point out that it is a team effort. Our EMS staff will be working with the county and the city to make that happen. And they also work, and they have been working very closely with the rest of the hospital staff. And as you know, we've already cared for a number of COVID-19 patients. We are communicating with tertiary care hospitals so that in the event that a patient needs to be transferred, we have those relationships already established so that we can provide that kind of tertiary care, higher level care to patients. We're prepared to do everything that we can do at our hospital, including we've had people working very hard on making sure that we have the equipment and the supplies, the pharmaceuticals that are needed. We've developed and instituted a number of policies and protocols. Again, medical staff, nursing staff, just a number of people throughout the organization. There are a number of details, but you don't have the time to go into all the details. I would refer anyone who wants to go back to the details of some of the preparation that we have done. You can always reference the board meeting that we had last Tuesday night. In closing, there's just one thing I want to say. I couldn't be prouder of the people that I'm working with right now, and that includes all of the medical staff and the clinical staff, all of our hospital staff who remain there to serve the community. Those are the people that we need to protect the most, because if we're going to fight this and keep this virus out of our community now, and prevention is the way to go, we need to do everything to prevent that for our employees. And we need to do everything to help and support and strengthen in any way we can the great employees we have at HGH. So I just want you to know it's the people at the front lines that we all need to be grateful for. Thank you very much.
Thank you, Karen. I really appreciate your comments and all the work your folks are doing there. I would mirror your thoughts and comments. So I'd now like to turn it over to Captain Sean Wilkin, Humboldt County Sheriff's Office, and to give us a perspective from the emergency management point of view.
Thank you, Dave. So from the emergency management perspective, at the onset of the COVID-19 pandemic and the federal declaration, we began working with county officials and medical providers for the protection of our community, as well as local government employees, while planning for the allocation of resources to protect employees and clients of county businesses. We also established to maintain ongoing communication with Nevada Department of Emergency Management. Part of that is updates on case statuses in our community and the numbers, And that's for possible resource allocation as these cases grow in our county or as we have to take actions to address these cases. Worked with the district attorney's office to prepare the emergency declaration, which went before the county commission, was accepted. The purpose of that emergency declaration to inform the public is so that we are eligible for recovery and mitigation funding at a later time through the state and FEMA based on the state and the federal declarations that were made. We've taken an active participant leadership roles in our local planning and preparation meetings. We're working with HGH and the local LEPC members for community planning and dissemination of information. As Dr. Stringham addressed when he was speaking, the ELCO hotline is something that we opted in on so that we were able to bring that resource closer to our community and have it more regional to the Northern Nevada, to the Quad counties that are along the corridor here. We've submitted resource requests on behalf of Humboldt General Hospital, Fort McDermott EMS, Humboldt County, and the city of Winnemucca for additional PPE and other resources, and those have gone into the state through emergency management. We've distributed PPE to our local law enforcement officers, to our deputy sheriffs, to make sure that they have the ability to protect themselves and still work with the community and provide the service that I believe our citizens expect while they're out on the road and they're handling calls for service. Due to the local COVID cases, we have initiated a partial activation of our Emergency Operations Center for the management of ongoing activities. So we are tracking resources, we are tracking what's going on in our community, and we are taking an active role in that. We're currently working to identify issues associated with response capabilities and resource availability to support healthcare agencies and our local systems. Our goal is to have things in place and have the information to the state to get those resources before we need the resources. We're trying to be a good partner with the state and not have to try to come up with things last minute. We are utilizing the Humboldt County Emergency Operations Plan and Mass Care Plans to ensure planning and response effort and to support the continued functioning of Humboldt County. And as Dr. Stringham mentioned, we're working with HGH for establishing the offsite hospital and taking a role of incident command for the establishment of the offsite hospital and the resources that are going into that. We're following all of the updated directives from the state regarding health protocols, business directives, hygiene and distancing guidelines. We've been involved with some of the community concerns that we've had with monitoring patients in the community and the ongoing things that have came there. And we're working with the county medical officer and the district attorney's office on those issues. Mirroring what Dr. Stringham said, and I said this in one of our meetings previously, everybody takes a leadership role, whether it's in the community, our households, our departments, wherever we work or whatever we do in our day-to-day lives. And that leadership role needs to be following these guidelines and working together and encourage good behavior, encourage the good social distancing, the good hygiene practices, following these guidelines that are put out by CDC, Nevada Department of Health and Human Services. Dr. Stringham is a county medical officer. This is an ongoing, very time-consuming process to allocate these resources and keep these ongoing contacts and communications available for Humboldt County. This is a daily basis. We're not taking weekends off from this. We are working on this every day. And so I want to really encourage the community, take that leadership role in your respective area, be a good leader, follow these guidelines, practice good hygiene, practice the social distancing, and make this easier for our medical care providers and keep those resources available for patients who may really need them.
Captain Wilkin, thank you very much. Appreciate the comments and my thanks to you as well. I've had the opportunity to work with Captain Wilkin a lot over the last year or so, but specifically with the COVID-19 response, and we couldn't have anybody better managing our emergency management front. And I thank you. I was fortunate enough in my life to spend a lot of time with Marines. And this gentleman right here knows what he's doing. He brought a lot of great skill sets from the Marine Corps. So thank you, Sean. We appreciate you very much. Next, I'd like to kind of turn it back to the board at this point. Actually, I take it back. Shane Moss. We were going to have Shane come in here if you don't mind. You were going to provide some additional information.
Dave, this is Monica. He had to get off of the line and get on another call.
Okay.
I asked him if there was anything that he wanted me to share, and he said not at this time. They've had similar calls and such like we're doing, and he's been keeping Elko informed as to NGM mitigation and statuses. So that's all that he had for today.
For the record, that was Monica Sill from Nevada Gold Mines. And so that's fine. We appreciate that very much. Chairman Tipton, I'd like to turn it back to you at this point in time and allow for discussion amongst the board. You're going to probably need to unmute yourself.
There we go. Yes, thank you. I don't know how many of the board members are on, but if any of you would like to comment at this time, please feel free.
This is Jim French.
Okay, Jim, go ahead.
I have a whole, I had a sheet and a half of notes here I wanted to share and ask questions about, and this goes back to our the chairman of this board. Dr. Stringham had provided answers to absolutely everything that was on my list, and it just tells me how closely tied to this he is and how he's got his ear to the ground, and I feel very comfortable that we have the right man to do this job right now. But he did say something to me today that I wanted to get on the record, and I think it's profound if you think about it. And he spent half of his presentation this morning talking about the things that we could do as leaders, not just county commissioners and city council and mayors and those types of things, but leaders in our community and people who have their own social circle of people that they deal with, and had to do with stepping up and actually pushing forward the message of not only how we can protect ourselves and our families, but also he put a challenge out there on the ground that I thought was profound. And that challenge is that this community has routinely stepped up in one catastrophe and one problem after another over the years since I've lived here. This is no different. And this community has the ability to provide the opportunity to control a very difficult problem just by social behavior and create a data set which could be helpful to communities all across this state and this nation. And I just would say that this is something that I think we should all take to heart. And I think this challenge starts with every one of us, not a community health board, not a community health officer, not a county commission, not a city council. And yes, we all have a role in this, but each of us individually but collectively have a role in this. And I want that message to get out because I really think this is a very timely challenge for us. And I think we could really turn this into something negative into a positive if this community steps up as it always has. Thank you, Mr. Chairman.
Thank you, Commissioner French. Commissioner Brizenden, do you have a comment to make? No? How about Commissioner Bell?
Yes, Commissioner Bell, I am very appreciative as well as with Dr. Stringham and all the efforts that he's had in all of this, and very good information today. So we, like Commissioner French said, this just needs to get out to the community. So I appreciate everybody's efforts, and that's all I had. Thank you.
Thank you, Commissioner Bell. Commissioner Cherry, are you on?
I am. I just have one additional, I guess, question, and that is in regards to, I've heard from some business owners, essential businesses that have to remain open or are remaining open, and their concerns for themselves, their employees, and their customers. Is there any additional I guess recommendations that they should consider to remain open and provide for the safety of everyone. And I guess I did hear Dr. Stringham say that there will be a team that will be coming around. I guess that can't happen too soon. Can they reach out and request that the team visit, or could they ask questions to the team?
Refer that to Dr. Stringham.
Yes, Ron, I think those are excellent questions. I think that the first is that if everybody just practices social distancing in the essential businesses, the way we're doing it here in my office, for example, we're an essential business, of course, in the private practice here. And the way we've been doing things is we've really taken things to the highest level that we possibly can. So the first is, at no point ever in this office will two people ever come within 6 feet of each other. And in the case that that's unavoidable, then we wear masks, we wear gloves, we wash hands, and we're very aware of any part of our body that's touched that person. And so if a person has to touch, for example, to draw blood or to do blood pressure checks or anything of that sort, we're going to wear gloves. We're going to remove those gloves as soon as we're finished. We're going to wash our hands. And the reason is because when you combat a problem, you have to know the nature of the problem and the very crux of where that problem is. And in this virus, the very crux of the problem is that viral particles have to get into somebody's eyes, nose, or mouth in order to cause a problem. So in a business, in a non-medical essential business in Winnemucca, for example, the way that I would handle things is if a person had to accept cash from somebody, number one, my preference would be that the cash be put on a counter, pre-counted, and so that the cashier and the patron never had to come within 6 feet of each other. The money would be received, it would be tendered, and then hands would be washed immediately after that. Once those hands are washed, then it's safe. Still not a great idea to touch a person's face, but it would theoretically be safe to do so. Generally speaking, I don't recommend that people ever touch their face when they're in the presence of anybody else. It just gives an extra degree of certainty that you're okay. And so I think as long as people are doing the right things, then it's really would be remarkably difficult to get the virus. And then you'd asked a second question. And I'm sorry, Ron, could you repeat that second question? There was a two-part question that you had.
Can they contact the team?
You're muted, Ron.
Okay. Can you hear me now?
Yes.
The second part of that question was, can they contact the team, maybe take a visit and make recommendations of possibly things they could be doing that they weren't, or doing things better?
Yes. First, before I answer the question, I'd like to put an announcement out to the community for those who are listening. We are still looking for volunteers to help us with this service that we want to be able to provide. So if you're interested, please contact me at the website that we listed. It's a Facebook page, and it's Stop Coronavirus in Humboldt County Now, or you could also contact me here at my office at 623-0550. If you're interested in making phone calls and helping us, we'd be very happy to have you. That's in addition to the emergency medical services personnel who are already assisting in this type of endeavor. And so if a business, to answer your question, if a business were interested in having this service provided, which usually would be done by telephone in order to bolster safety, to minimize contact with people, please contact me at my office at 623-0550, or at the Facebook page that I mentioned. And what we're going to do is get a roster of users and then a roster of providers put together so that we can make those people up. It's a service that will provide various types of information and no enforcement or anything of that sort. It's all under the guise of giving information, useful things, and partnering with people. But Ron, thanks so much for your question.
Commissioner Cherry.
Thank you, Commissioner Cherry. I'd like to go back to Commissioner Brisbane and make sure your microphone is turned on, Commissioner Brisbane.
Commissioner Tipton, while we're waiting for Commissioner Brisbane, I would like to add on a little bit to that. We have identified some volunteers, but as Dr. Stringham mentioned, we can always use more. As soon as we get a group of folks together, we're going to have a training. We hope maybe as early as this afternoon or tomorrow, and we'll train these folks. We do have a list of all the essential businesses and the telephone numbers. I want to thank Nikki Lynn, our Human Services group, compiled all that information. We also have, with the help of Walmart and a number of sites around the country, put together some documentation to help these businesses. And I think the point will be of that is that the goal will be to call them and work with them, not tell them how to do it, but ask them what their current protocol is, and then offer any insight into this other things that we may offer to them. And by the way, that includes, fueling stations, grocery stores, liquor stores, whatever happens to be still be open. And so, but we've got some other insight that we've taken a lot of time and effort to identify some possible ways to, again, to mitigate this situation. So, so we're on that. Hopefully, maybe as early as this weekend, we'll start making calls.
Okay, thank you, Dave. Commissioner Brisbane, are you on now? She texted me and said she was having trouble. Do you show her on the call still, Dave?
I'm just looking right now, and I think she's been disconnected. I do not see her. So I'll text her, let her back in.
She just texted me, and Commissioner Brisbane said that she would like to thank all the first responders for all of their work during this time.
Mm-hmm.
I think that covers the commissioners. I too would like to thank all of the first responders, and I would like to thank all of the people that are putting their best foot forward and maintaining their social distancing. And I would ask that everybody that is on this call, speak to your friends, talk to your friends, and make sure that everyone is put in the place to become a leader and to tell their groups to social distance as well. And with that, I'm going to go to the next item, which is discussion regarding efforts to disseminate critical information to the public for possible action. Consideration, discussion, and possible action regarding disseminating information, including but not limited to confirmed positive test results for COVID-19 to the state of Nevada and local media outlets, agencies, and other means of mass communication to keep citizens and other agencies informed. Discussion and possible action. And I'll turn this back to you, Mr. Mendiola.
Thank you, sir. Appreciate it very much. So what I wanted to do here is give a little background on what has happened to date with respect to getting and disseminating information to the public. And obviously there's been a lot of concern out there, rightfully so, wanting to know as much as they can about, specifically who's testing positive and how do they react to that. And I think we've covered that today. As I think Dr. Stringham pointed out, it doesn't really make a lot of difference whether you know who's infected or not if you just follow the guidelines. And I hate to keep reiterating that, but that will solve 90% of the problem right there. And again, disinfecting your work area, your hands, your home, and keeping your distance from not only your family members, but also the public. So, and that's a hard thing to do, I realize, but that's the key. But with respect to information, early on, the hospital took control of that for obvious reasons. They're right in the middle of the storm. And so as part of their response to that, they were working with Nicole Maher, who is their public information officer. And so they were disseminating information. On Sunday night, I had a discussion with Karen Cole, And after listening to her story, it became very apparent to me that they are all hands on deck trying to prepare and to know how to respond to the virus in our community. And the last thing we really need them doing is having to be an entity that provides information constantly. That's not what they specialize in. So what we did is Karen and I agreed that we would like Nicole Maher, who really has spent 20 years working closely with the hospital in that same capacity, and also has a very strong relationship with Dr. Stringham and all of the doctors and providers at the hospital. She seems to be the perfect person to pick up the mantle and move forward and work with the county health board, and Dr. Stringham is the chairman of that board, to disseminate information. So over the last day and a half, that's exactly what we've done. We've kind of recreated ourselves and trying to figure out what kind of information do we need to collect? How do we want to disseminate that information? And so that's where we are today. And so the agenda item before you today is to provide direction for Dr. Stringham, myself, and Karen Cole primarily, as well as Captain Wilkin, as to what kind of, how do you want us to collect that information? How do you want us to disseminate it? So at this point in time, what we have done is Nicole Maher, her agreement to serve in this capacity will be dealt with on Monday, April 6th at the County Commission meeting. We'll have her agreement on the agenda for us to approve that. Assuming that happens, it's going to be my recommendation to the Board of Commissioners to do so. We will launch this program. However, we're really already doing it right now. And so what Nicole is doing is working closely with the hospital, closely with Dr. Stringham, and any other source of information that's coming in about the virus. And every day she is working with Dr. Stringham to compile information that we can disseminate to the public. Dr. Stringham mentioned earlier about HIPAA. That's always a challenge because there are very strict laws about personal information. And having spent 30 years in the medical industry, I'm very much aware of the challenges around that. So we do have to be careful. But again, that's probably not that important. What's more important is that we do the right things ourselves. But having said that, so the plan today is, and what we did really yesterday for the first time, we gathered the information. Dr. Stringham prepared a press release along with Nicole. We then brought in the district attorney's office, the city attorney, Kent Maher, and they also connected with the attorney general's office. And they looked at the material that we wanted to release. They approved it, and then we released it. So at this point in time, I'm very comfortable with that process, using Nicole as that cog in the wheel that allows her to go to the hospital and all the people that she needs to reach out to, along with Dr. Stringham and any other individuals. So that is how we're doing it today. So with that, I'd like to turn it back to you and see what the board has to say about that.
Okay, you're turning it back to me? Yes, okay,
Yes.
Go ahead, Mr. French.
Thank you, Mr. Chairman. So I'm understanding then that the proposal is going to be that we periodically prepare a press release that will be disseminated through the Attorney General's office and then released in the county, I'm guessing through the traditional media outlets. With regard to updating the website, how often will we be looking at updating that website? And because I think a lot of times that information needs to be timely. And I think we have an opportunity. I would like to see us not only report on the progression and the spread of the virus, but also report on and a shout out to those folks that are involved in our community, especially our small businesses and whatnot that are still operating, as far as complying with the recommendations and giving recognition where we can. I think it's positive feedback to the community on a regular basis, I think is important. So to get everybody on board and not to get virus fatigue, so to speak. I think there's a lot of that going on right now. So I think we need to take a positive message when we can, and I think that needs to go out as well. Thank you.
Thank you, Mr. French.
Thank you, Commissioner French. So what I'd like to do is I'm going to hopefully show you my screen here, and I'm going to show you some of the things that we have done. We have been doing for well over 10 or 12 days now. And then also a couple of the releases, actually the release that went out yesterday to answer your question as to what we're doing. So I'm going to share my screen here now. And what I will do is, I hope you can see this now. Can you see the Humboldt County website?
Yes.
Yeah.
All right. So if you go to the Humboldt County website, you'll notice along the top here, it says COVID-19 updates. All you have to do is click on that. And then the alert center comes up, and there's a number of alerts in here. I was trying to move this to the top, but we haven't been able to figure out how to get that 911 telephone piece down there. But you just go down to the third item, and it's coronavirus disease 2019. And there's a number of things here, a lot of the governor's releases and things that you can look at down in this area right here. A travel advisory that just came out from the governor's office. But in terms of the information I think that you are referring to, is you would just click on this Humboldt County coronavirus updates and information. And that opens it up here. And so what you're going to see is a couple things. At the top here is the emergency declaration that was issued by the Humboldt County Commission back on March 23rd. There's a press release here from the about the elections and how the primary elections will be done by mail-in ballot. And then right here, there is a press release that went out yesterday. This is the first time we actually did this. And that brought up this one on Humboldt County Health Officer letterhead. It's from Dr. Charles Stringham, MD. And if you read through this, it gives the latest information of 2 additional cases of coronavirus and bringing a total to 7. And then Dr. Stringham makes a comment here emphasizing the importance of following social distancing guidelines, as he's mentioned today. And then he actually breaks down the 7 positive cases by gender and age. So this is something that we were cleared by the Attorney General's office to provide this information. And one of the things I think is important here, and I'll let Dr. Streeman comment on it, but is if you look at the comments after each one of them, starting with case number 1, there was no recent travel history. And then all of the others, 2 through 7, were known to be close contact of the original reported case. So what that really means is that this is a group that was all together, and which is on one hand very sad. On the other hand, I think important because it proves that if you're not gathering as a group, whether it's your local service club or your family or friends, you're probably not going to pass this disease around. In this case, they made the mistake of getting together, and here we are. So, Dr. Stringham, would you like to add anything else to that?
Well, I think that I agree with what you said. And I think to me, the most important thing is what we do and what we choose to do with the information that we have from this time forward. And a lot of the things that we take care of in healthcare have to do with mistakes and things that didn't go very well. And my personal feeling is we need to use the information that we have. We need to use the techniques that we have available to us and go forward and do things the right way from this point forward.
Thank you, Doctor. So just to finish up here with the press release. So this is a release that will come out it maybe not every day, because if we don't have additional cases, there's really not much more to provide in terms of a specific reference to the cases, known cases in our community. But as of the last 2 or 3 days, we have been updating this every day because we've had new cases every day. But I just wanted to show you that. So that comes out every day. It's on the county website. We also link it to many other websites. So HGH, it goes on Facebook, the Humboldt County Facebook. And so you can find it in any number of places. One of our challenges, and I'm going to really talk to Nicole about this, is how do we get this information to people who do not use the internet, who do not necessarily use email, and may not even use texting or anything like that from their cell phone. So we're working on some different ideas. Obviously, the newspaper could be a big help on getting that information out, because people still do, a lot of people that don't do some of the new technologies are still reading the newspaper. So we're looking for ways that we can deliver this information in that regard as well. So I'm going to close that right now. And then I also want to show you, this has been going on actually for, I think, almost 2 weeks, if I'm not mistaken. And Nicole Maher has really been the focal point of this. We started this early on after a meeting with the city and county law enforcement officials, HGH, myself, the school district was there, fire districts down at the police department. And we came up with this idea that we would come up with a way to provide as much information in our community as to what was going on, everything from what's happening with the virus itself and positive cases, to also how's it impacting our county offices, city offices, law enforcement, school district. And so right below here under latest updates, if you go to that and you click that open, it opens up this website, which, by the way, is top notch. I've looked at a lot of them around the state, and this is really, really good stuff. So what you do, oops, I think I got rid of it here. Sorry about that. Where did I go? So you just click down on this, and you can just pull down, and so you'll see at the very top, it has usually some new information. And again, it's just reiterating what the press release said. There's 2 additional cases, total of 7. And then you'll find new information from various sources, Health and Human Services, Humboldt General Hospital, some specific really great stories like Dr. Jeremy Keener, who was able to provide 42 boxes of masks and 30 boxes of extra gloves and a number of other PPEs. So what a great story, Dr. Keener stepping up on that front. I also have heard now from another dentist in town, Dr. Rick Grant, who is willing to help in any way that he can, including providing equipment or anything else that he can. So people are really coming, forward to help in many different ways here. And so if you'll go down through here, there's more information. Here's the information about the HGH West Campus at 51 East Haskell. It is the screening center. And it tells you what the hours are of that center and where to go. If that center's not open, if you happen to need to go there after those hours are available, where to go. So again, a lot of information. And as you go down farther, here's the City of Winnemucca Police and Humboldt County Sheriff's Office. We've got some information in there. And again, as you go down farther, I don't want to go through all of it. School district information, Humboldt County information. And on the Humboldt County information, just so you know, we have every office is represented here. So if you have business with Humboldt County, if you can just go to this page, there's a telephone number for every office. Give them a call, tell them what your issue is and the business that needs to be done. If it's critical and time sensitive, they'll set up an appointment for you to come into the office, get the work done. And if not, if it can hold off, they'll encourage you to try to do it online by phone or by fax, and or to just wait a few weeks until which time we have a different situation on the ground. So, and again, as you go down farther, there's even more information down here having to do with City of Winnemucca, State of Nevada, and then also local essentials, different convenience stores that are open, what's going on with school kitchens. And we also talk about our sewer system, which is, you never think about, but we're really trying to tell people to do not put things down the sewer that you don't normally put down into the toilet. So toilet paper only. All the sanitizing wipes, do not put those down the toilet because it can cause problems for our sewer system. So there's a lot of information available every day on the site. It's updated every single day by Nicole. And again, it comes from all kinds of sources within the community. And so that's a great source of information there. So this is the key place. You can go to the county website, but you can also find these links all over HGH, City of Winnemucca. You go to their site and all these same links, or you can find them anywhere. So that's, I wanted to report that to you to answer your question, Commissioner. And also, while I'm at it here, I thought what I would do is show you just a brief mitigation protocols that we talked about earlier, going to our businesses and providing some information on what's going on, for example, at Walmart here. This is just a document that we stole from Walmart, telling you what they're doing in the world of grocery stores. And then we went down and we delved a little farther into other businesses and gave some information, very specific information about how we can better mitigate the exposure. And then also, as I mentioned, fueling operations. This is the kind of information that will be shared with business owners that we reach out to through our volunteers. So that's the information I wanted to share at this point in time to answer that question.
Do you have anything else, Commissioner French?
Can you hear me still, or am I muted?
Yes.
Okay. I think, Dave, everything you said, I have to agree with. It keeps coming back to a central thought, though, that you brought up initially, and that was how do we get to those folks who aren't on the internet, who don't access the internet, who don't have the ability to access those websites and such. And I kept thinking, we have to do that with regard to the open meeting law notifications and public postings, and even creating a mailing list for those entities which might have a group of people that they could disseminate to, such as the senior center. I think there's some opportunities along that line. I know there's a lot of concern and a lot of anxiety with regard to those folks at the senior center right now as to what their risk factors are and what they can do. So I think we might want to take a look at trying to create a mailing list for distribution. I think ultimately, though, with regard to the essential businesses, and I really like that website with regard to what Walmart has done. But everybody's not following that protocol in our town. All you have to do is go to the 3 or 4 retailers we have for the grocery stores, and they're all handling it a little bit differently. And I think it's not because they don't have a care or anything. I just think their approach to it's different than somebody else's. And but I think with regard to the people that are operating within the grocery store, not necessarily the checkers and whatnot, the folks that are doing the stocking and whatnot. I know that goes on during the day as well as in the evening. Those folks, I think that's an opportunity for us to implement some of the guidelines having to do with not only social distancing, but the wearing of the masks and whatnot. I think a lot of those people are, bumping into us as we're going up and down those aisles and whatnot. And I'm sure there's some concern along that line. Those are my comments. Thank you.
Thank you, Commissioner French. Commissioner Brisenden had a question for Dr. Stringham, and that was, can you share if there are any new cases as of today?
There are a total of 7 cases in the county so far. We have one person who was diagnosed in a different county who has come here to Winnemucca in order to be able to convalesce. So that was a case that was not diagnosed in Humboldt County, but was brought to Winnemucca, to Humboldt County, and that person is in a strict social isolation or a strict respiratory isolation, and is cooperating with us and is doing all the right things. So a total of 8 cases, 7 of which originated here in Humboldt County.
Okay, thank you very much. I wanted to go over a couple of things, Dr. Stringham. One was early on in your comments. When someone is found to be positive, and that comes from the state epidemiology department, do they do the investigating then as far as what contacts have been made?
Yes, they do. So
Okay.
the state epidemiologist's office does a thorough investigation. It happens very quickly, and essentially they have a list of criteria that they use. So they interview the person of interest, the person who has a positive test, and then they find out who that person's had contact with. And it's not just that, they also ask about the nature of those contacts. How close did you get? How long were you in contact? Was there physical contact? Are you having any symptoms? How many people have you been in contact with now? And so they do a fantastic job. They use a pretty advanced computer program that I have some familiarity with based on what I've been told. And I can tell you the other thing that might be of interest, kind of along these lines, is that they really do a fantastic job. They're very dedicated. They answer their phones all the time. I've not had any cases where I've called and it's taken them longer than a couple of seconds to answer a phone. As busy as they are super efficient and doing a wonderful job. I've been very impressed.
Thank you very much. I appreciate that. As far as getting information out, the only thing I have to say is I think as soon as we can get it out, the very soonest we can, would help with the rumors that go around town. And if we all are linked to this site, which I think is a very good site that's been put together, the sooner that information is out there, the less information for the rumor mongers will be to get it out incorrectly.
Yeah.
So, Commissioner Cherry, do you have any other comments?
Yes. I would just like to, maybe it's being done already in our releases, but I think we could put in release that, you know, if you know someone who does maybe is homebound or does not have this technology to receive these updates, reach out to those people and make sure that you make them aware of these releases and tell them what's happening. And along the lines, that same line, I have gotten really good feedback. People are much happier with the release that came out yesterday versus what we've been doing. It provided them just enough information, I think, to, I don't think everybody's looking for names. They understand that HIPAA prevents that, but just a little bit more information is very much appreciated.
Thank you, Commissioner Cherry. Do you have anything else, David?
Yeah, I just wanted to ask Dr. Stringham if he could give us a quick update on all of the current positive cases. I've gotten several emails. People just want to know, what is their current situation? Are they at home? Are they in the hospital? Where are they?
You know, Dave, before I answer that question, I would defer to Wendy and ask if it's all right that I give some details on that.
Thank you, Dr. Stringham. This is Deputy District Attorney Wendy Maddox. I think it is appropriate if you speak in general terms. I do want to mirror what Dave Mendiola said. Obviously, this is a new situation for us as attorneys, as well as the public with this pandemic and the outbreak. And District Attorney McDonald and myself, along with Chief Deputy Kevin Pasquale, we've been in consultation with the AG's office, and basically giving them grids and information and saying, is this okay if we release this information to the public? They are saying that they are comfortable with you releasing brief information in regards to whether they're in the hospital or self-isolating at home.
Okay. And Wendy, I just want to make sure that it's okay that I explain whether they're improving and kind of what their general status is, meaning guarded, critical, improving, that sort of thing.
Yes, I feel like that would be appropriate as well, based on the conversations that we've had with the AG's office. If you can speak about it in general terms and not specific terms.
Okay. So, Dave, the situation is that of the 7 patients that we have who were diagnosed here in Winnemucca and the 1 additional case that was moved here to Winnemucca, the 1 additional case is improving and is in respiratory isolation. My understanding is that that there's 1 patient who had been on a ventilator at our hospital and was subsequently transferred to Reno. As of my last education about that, which was yesterday, the case was still pretty serious. There's 1 person who's at Humboldt General Hospital, and my understanding is that they're in stable condition. And then there are a total of 5 individuals who were diagnosed here in Humboldt County. And my understanding is that each is still in respiratory isolation, but I'd have to say that I don't know if there have been any cases in Humboldt County that have already been released from respiratory isolation. Does that answer your question?
Yeah, I think so. The main thing when you say respiratory isolation, that does not mean they're in the hospital necessarily, right?
That's correct. So there are currently 2 patients who are hospitalized and a total of 5 patients who are diagnosed in the community who are still out in the community and presumably well enough that they don't require hospitalization currently, who are still in respiratory isolation. And 1 that was diagnosed elsewhere and transferred here to a residence in order to convalesce.
So they're basically quarantined. Those 5 are quarantined, probably at home, one would assume.
Yes.
Okay. That answers my question. I think the questions that came across there.
Yeah. Mr. Chairman, this Commissioner Bell.
Commissioner Bell, go ahead.
Yeah, just a couple of things here. So one of my comments would be: is there a hotline that we could provide for the people that are challenged to the web access, and then also for the purposes of today's meeting, it doesn't look like we have any actual actionable items. I suppose I'm very comfortable with Nicole, and if we're going to put that on our next commission meeting, then if we can proceed down that path, that would be just wonderful with me.
Okay, thank you.
Mr. Chair.
Hotline.
Mr. Chair, yeah. So let me cover a couple things. There is a new hotline that's actually out of Elko County. We will share that today. We'll get that information out today. We were just offered by Elko County to be included as part of that. I think Dr. Stringham, I think, likes that idea. And so we will get that information out in the form of a press release and also on the website, the information that you saw. And so you're right, that would be a great way for people to make a phone call, ask questions. And again, that's being handled out of Elko County. It's also being utilized by Lander and Eureka counties. So we are working regionally with folks too. This is the first time we've all kind of reached out to each other, which is a good thing. With respect to Commissioner Bell's comment about we don't have any actionable items, there is one thing that I do want to get from the board today is to get a motion to just give us the directive to move forward as mentioned, because we talked about what we're doing today, how Nicole's gathering the information, Dr. Stringham is massaging the information, and then we run it through our attorneys. If that's good, we'd like to just have a motion to use that model for the time being, and that would be helpful to us.
Yeah, Mr. Chair, I make that motion. This is Commissioner Bell. I'll make that motion.
Okay, do you you have that information, Wendy?
Yes, I do. I just want to clarify for purposes of the motion. I'm hearing from all the commissioners, the board today, and the sheriff.
Did we lose you?
Wendy, if you can hear us, you went on pause or something. We lost you.
Can you clarify your motion, Mr. Bell?
Yeah, the motion would be to proceed as directed, as Mr. Mendiola had stated in his earlier comments, and to proceed with all of the recommendations that he had made in that. So that would be my motion.
Mr. Chairman,
Okay,
this is Commissioner French, and I would second that motion.
Okay, and we have a motion and a second. Any questions on the motion? Not, I'm going to go by roll call since we're having trouble. Commissioner Brizzeton texted me that she says aye. Commissioner French?
Aye.
Commissioner Cherry?
Aye.
Commissioner Bell?
Aye.
And mine is an aye as well.
So you'd also need to, Commissioner, you also need to poll Sheriff Allen, who is a voting member, and also Dr. Stringham.
Sheriff Allen?
Aye. And this is Dr. Stringham.
And you're not?
Yes.
Okay. Everyone has voted aye.
So at this time, Commissioner, what I'd like, I'm not sure. I'm looking here to see if she's still on or not. She may have moved on to something else, but Nicole Maher.
Excuse me a moment. I have the motion here, and we may have to do another motion. I have a text from Wendy. Her motion said to disseminate information to the public through the website and other means for those that get it ASAP, including Spanish, info on progress on status and COVID positive patients, positive feedback to community mitigation efforts of business and in Spanish through Nicole Maher and Dr. Stringham. So.
Okay,
Yeah,
Mr. Chair, if you want to, I can amend that motion to include the comments from Wendy.
Okay, the motion has been amended by Commissioner Bell. All in favor, say aye.
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 Aye. I think everyone has responded with an aye on that. And Commissioner Brizzeton says aye as well. Thank you.
So Commissioner Tipton, so just FYI, Abel Del Real Nava, Assistant County Manager, HR Director, is working with Nicole Maher to translate all of our Spanish information at this time. So we will include that in our future updates on the websites and all of the other formats that we'll use to get that information out. And as well as the other information we talked about, the hotline and the like. So, and so if you want to move on to the next one, I think we can probably, we've kind of done all this, but if you want to read the last agenda item, we'll go from there.
Okay, moving on. Plans going forward to battle COVID-19, consideration, discussion, and possible directives to county personnel, agencies, and businesses to stop the spread of COVID-19. Back to you.
So as you can tell through the course of the discussions and the presentation by Dr. Stringham, I think the plan that was outlined, we're already well underway. It's a 3 or 4 pronged approach, and now, you know, everybody's working tirelessly to do the best we can to cover all those areas. In my mind, the most important one right now is getting out to these businesses, getting this information to them and working closely with them. And so, as I said earlier, our hope is that we can get the volunteers in a training session with Dr. Stringham, possibly by the end of the day or first thing tomorrow. And those calls will start maybe even as early as tomorrow. And we'll start engaging with those business owners.
Okay, thank you. Does anybody else have anything to?
Mr. Chairman, this is Commissioner French.
Go ahead.
I also had a question I wrote down coming from some of Dr. Stringham's comments initially having to do with recommendations toward daycares. Is that something that we need to update a policy with regard to that? I know my feeling from those comments was that that was a weak link. Maybe get some thoughts from Dr. Stringham as to what this board should probably recommend.
I think the first thing that needs to happen is a little bit more research into what's possible. And I think it is a weak link. It's something that's a weak link almost by design, by the nature of what happens in daycares. The difficult part is that so many people at this point are having to work in critical industries, and for the kids who are those of people in the critical industry, I think there need to be some specific things that wind up happening. And I think in a general sense, I would say that the fewer the kids at any particular facility, including residences, primary residences, the better off we are. Ideally, it's best if kids stay in their own residence and that the only people they have direct contact with are their parents. It's remarkably difficult to separate families in social distancing techniques, especially young kids who need to be bathed or who require specific assistance. And so in older families with teenagers or kids who are old enough to be able to do their own activities, to do their own hygiene issues, eating, things of that sort, then social distancing should even be practiced even at home. But for the young ones, it's necessary that we have contact. And so my philosophy there, my ideal explanation would be that we try hard to make sure that even at home, unnecessary touching, unnecessary contact, unnecessary closing on that 6-foot rule should be avoided if it can be. If it can't be, then we need to understand that family essentially becomes, for example, a family of 4 becomes a group. And if one person gets infected, it's very likely that all will be infected. But still, if parents are the only ones who are going out and parents are practicing all the safe practices, then those kids are very unlikely to wind up getting infected. So the take-home message, I think, is that we're just best. In some situations, we have to have visitor kids who come over to somebody else's house in order to be able to be watched while critical parents are out at work. But then that group may become a group of 6 or 8 people, and there again, if one person gets infected, everybody does. So we just need to exercise extreme caution. But my point is that to have 3 or 4 families get together, the more families get together with sharing responsibilities for kids, the more dangerous that becomes. So I know that you're looking for a specific answer, and maybe it would be best if we just come up with a policy or an official stance that I can articulate and then get back to this board at a subsequent time fairly quickly.
That'd be fine. Thank you.
Do I have any other comments from any of the other board members, commissioners and/or health board?
Mr. Chair, I just was looking through my chat room here, and we did have a comment from Winnemucca Domestic Violence Services, Tiffany over there, and just wanted to remind that they too are first responders and are often called out by law enforcement. And they have some needs in terms of some PPEs, and we'll see what we can do. I'll work with Captain Wilkin to see what we can do for them. But I just wanted to recognize that she did send something in here before we got off the line.
Okay, thank you. Any other comments? Well, we need to move on to future agenda items. Do we have any specific items that you want put on for the next meeting?
I have none.
I have none.
I have none.
I have none.
Let me see if I can.
I have-
Marlene said. Sheriff, did you have one?
No, I have none as well.
Okay. All right, I don't have any right now, so we will let that work itself forward. Do we have any public comment? Is anybody wanting to comment, Mr. Mendiola?
I have nobody at this point in time.
Okay, then we will need to set a future meeting date.
I'd like to recommend that, considering the current conditions, that we try to meet weekly, and so possibly next Thursday. And at that time, in terms of the previous item, future agenda, we'll kind of make it more of a general update on, COVID-19 and specific to Humboldt County, and also update you on our the work that we've done with respect to contacting local businesses, and just kind of give an overall update on everything we discussed today.
And that'll be next Thursday at 9 a.m. again?
If that works for everybody.
It works.
Works for me too.
Works for
Okay,
me.
we'll set
I'm good as
the
well.
meeting. Okay. We'll set the meeting for next Thursday at 9 a.m. What is that date? April?
That'd be that would be the 9th, yeah.
Okay, this meeting is adjourned at 11 o'clock. Thank you, everyone.
Thank you, everybody. Appreciate it.